One of the areas where especially what is important to our philosophy and practice is children's vision. And the vast majority of parents don't have the slightest idea when you should have a child in for their first exam, and they're stunned when we tell them 6 months old wouldn't be a bad idea. Certainly by the time they're 3 1/2, all people should have their kids' eyes evaluated by someone who's skilled at assessing a child that age. Not all doctors even want to or have cultivated the skills, but it's very doable. Many parents mistakenly think that you can't at that age because they can't read and that they're little and they're scared and so forth. None of that's a big problem. We do free eye assessments at the age of 3 1/2 because we want to intercept eye and vision problems peculiar to that age that can make or break their lifetime ability to see. So in our opinion, everyone should have their kids' eyes tested by an eye doctor, not just a faraway eye chart test. Our free assessment involves looking inside their eye, checking them to see if they have a glasses prescription, testing how well their eyes work together as a team, and so forth. And the child usually enjoys it and thinks that we just played some games with them and it was fun. It takes about 10 minutes. It's very non-threatening. And we want to catch a vision development problem called amblyopia. And the consequence of missing that is subnormal vision in one eye for life that isn't fixable with glasses or surgery. Assuming the child has passed that, they should be seen annually from kindergarten on throughout the school age years. Not necessarily because they can't see the board. School screenings, while very important and very valuable, are very limited in what they can find. Most parents and teachers mistakenly think that if a child passes a school vision screening with 20/20 that their eyes are perfect in every way and that they don't need to have their eyes checked and that makes or breaks whether you should have an eye exam. And nothing could be further from the truth. Most vision problems that could interfere with the learning process are difficult to detect in a standard 20/20 eye exam. Vision, near point vision, is learning happens at near point. And what the eyes do here is completely different from what they do when they look in the distance. It takes no work to look at something that's 20 feet away or beyond. It takes a lot of work to keep this focused and the eyes aligned properly for near. And many young people are struggling here and nobody recognizes it. It can interfere with their ability to learn how to read and write. And it can also cause eye strain, fatigue, and headaches in older children or teenagers or young adults that are doing near-point tasks. But a problem with near-point problems is a frequently overlooked reason for children to not be achieving what they should in school. Quite often, everyone knows the child's intelligent, they're not performing up to their ability, and they think, well, it can't be their eyes. They were 20/20 on the school screen. 20/20 does not mean that they're perfect. 20/20 is limited in what it means. Yes, it's good, but it's very limited. There's way more to vision and eye care than how you do on an eye chart.